This coming as the conservative House Freedom Caucus officially has endorsed an Obamacare replacement bill introduced by Republican Congressman Mark Sanford and Senator Rand Paul. Joining me right now is South Carolina Republican Congressman Mark Sanford. Congressman, good to have you. Thanks so much for joining us.
My pleasure.
So I've spoken with Rand Paul, your colleague on this, a number of times about it. What can you tell us in terms of party leaders getting behind your bill?
Well, that we're hopeful. I mean, I think that, as with any piece of legislation, there are contest of ideas, and I think that our bill has a number of things that I think make common sense, would help ultimately the healthcare consumer, and would help in the pricing of healthcare.
Well, let's talk about that, because can you identify the changes that your bill makes to the Affordable Care Act that will, in fact, lead to lower costs?
It does a number of different things. For instance, one of the things that's driven up cost with the Affordable Care Act has been what the government deems essential benefits. And what that means is that it drives up the price. You've got a bigger basket of health care goodies, if you want to call it that, that we're required to buy. And as a consequence, a lot of young people said, I don't need all that stuff. I'm not buying. And so literally, I mean, roughly 20 million people, either by exemption or by saying, I'll pay the fee, have said, I'm not buying. So what this bill does is it makes affordable insurance for the first time legal. It does things like allowing to buy across state lines. It does things like allowing pooling. In other words, giving a team of realtors across the country the ability to go in together, pool as a group, and as a consequence buy insurance. Again, I think has a lot of different merits. I mean, one of the things that can I mention one other that I think makes it important is that it turns on its head the way in which pre-existing conditions are handled. Right now with the Affordable Care Act, you literally wait until the house is burned to go out and buy homeowners a policy. You literally wait till the car is wrecked to go out and buy auto insurance. And so the way it works now with the Affordable Care Act is you could go to the doctor's office this afternoon, be diagnosed with a horrible illness, cancer, and then tomorrow sign up for health insurance. That turns on its head every single mathematic component of what really drives insurance. And our bill says the reverse. We have a 2-year phase-in where you can get locked into a plan. You have to stay on it. As long as there's continuous coverage, your pre-existing condition is covered, but you can't do what we do currently, which is wait to the 11th hour, which basically causes people, again, to say, I don't need insurance, I can sign up after I'm diagnosed.
What about the worry that so many people will be caught in this middle period where changes will take place and they'll lose their health coverage? Every time you speak with the skeptic of the repeal and replace, they'll say, look, 20 million people have the insurance, let's not change that right now.
Well, but again, to Mitch McConnell's point that played just a moment ago, this plan is on a death spiral. I mean, South Carolina, we've gone from 3 providers just 2.5 years ago down to 1 provider. Premiums went up by 29% just this last year. And you could see those same things mirrored across the country with increasingly little choice and more in the way of price. So I guess the easiest thing politically to do would be to sit on the sideline and say, let it fail of its own weight. But in that process, a lot of people would get hurt.
Congressman, there's a new political poll, and it shows support for Obamacare is actually rising among Americans. 45% of the registered voters say that now they approve the legislation. So how can the president appeal to Congress to get a replacement passed with constituents apparently still split on this?
Well, I think it's gotten a lot of media attention over the last couple of weeks. I had a town hall meeting on Saturday, and there were a lot of folks out who had, you know, important things to say with regard to health care and what it meant for them. So I would say that poll is in part a reflection of the amount of news coverage this issue has gotten of late, and therefore probably not indicative of the bigger balance between the people who are paying for the system and the people who are receiving in it.
Yeah.
What I would say is that reality is probably going to be a blending of the two. I mean, I think baked into the cake at this point is a young person staying on their parents' plan until the age of 26. I think baked into the cake is addressing pre-existing conditions in a way that they weren't addressed prior to the Affordable Care Act.
Yeah, that makes a lot of sense. Let me ask you this, because, you know, we've had Zeke Emanuel on this program many times, one of the architects of Obamacare, and he refuses to acknowledge that Obamacare had anything to do with economic growth slowing down. And I've made the point that I speak with business managers all the time and CEOs who tell me that is the reason that they did not invest in new workers, and that is the reason that, in fact, the economy stayed below 2% for as long as it has. What's your take on the impact of Obamacare, the legislation, and its impact on economic growth?
That it's been real, just as you suggest. I mean, with all due respect to him, I think he's completely wrong in that at many different levels it doesn't fit with what I'm hearing here on the ground in South Carolina. So, I mean, literally, I had a friend call me just last night. He's sole employed, doesn't have employees, but he walked through the numbers on what had happened to his health insurance over the last couple of years. I have other friends that are in small business. They tell the same tale. And if you look at the real driver of job growth in this country, it's more often small business than it is large business. Disproportionately, small businesses have been hurt by the Affordable Care Act.
Yeah, and you could make the argument that that's one of the reasons that Donald Trump was elected into office. His promise of repeal and replace, that's what small business, medium business, and obviously individuals wanted. So what do you make of what's going on at these town halls across the country? Lawmakers at town halls being pressed by constituents who say they disagree with the president's policies. Republican Senator Chuck Grassley was greeted by angry Americans disapproving of Trump's travel ban. Watch this, sir. I want to get your take.
Mr. Grassley is saying that we are trying to get the American people saved. But I am a person from a Muslim country, and I am a Muslim. Who's going to save me here?
And then the president tweeted this: the so-called angry crowds in home districts of some Republicans are actually, in numerous cases, planned out by liberal activists. Sad. That's what the president tweeted last night. Congressman, what do you think? Are you hearing that? Are you hearing this from Americans in your district, first of all?
Not in my district. I mean, you've certainly heard, again, from different colleagues. Some people have talked about paid protesters. Some people have talked about organized protesters. I think the folks at home, we had, I mean, I was in a town hall meeting for 3.5 hours on Saturday morning, are certainly organized. There's a degree of orchestration. Many people carried like cell phones that had agree, disagree, that have signs, whatnot. So there's a degree of orchestration. But in fairness, I mean, I think this is about the most basic premise of politics, which is it's hard to take something away, it's easy to give it. And so the folks who benefit from the Affordable Care Act have benefited mightily, and taking that away from that group of folks is tough in political terms. I don't think we're talking about taking anything away. I think we're talking about replacing it with something that's sustainable, because the reality of the Affordable Care Act is that it's not sustainable, and for the other 80% of the folks out there, it's been quite costly.
And we know that much of the repeal and replace will dictate the other business at hand, Congressman. So, you know, when you look at the markets and what they're anticipating from tax reform and the rollback of regulation, these are high, tall orders that people are expecting from you and your colleagues in Congress. So if you don't get the repeal and replace done on a timely basis, what does that mean for tax reform? What does that mean for all of the other pieces of business on your desk? Can you walk us through an acceptable timeline that you see how 2017 plays out with regard to Obamacare replacements and the rest?
The key is what you just said in terms of and the rest. You know, the normal Congress will have 2 or 3 big issues in it. This one probably has 7 or 8. I mean, it's a fairly gargantuan legislative list. So, you know, we're going to have infrastructure bill. You're going to have a debt ceiling vote. You're going to have a debate on the budget. You'll have a CR, something to carry you through funding for the rest of the year. I mean, there are just a lot of things on the hot plate. The 2 big items that you just mentioned, though, first is the Affordable Care Act. It's got to happen sometime late spring, minimum by early summer. It's got to happen sooner. later, because if not, it completely jams up our ability to move with tax reform.
Right.
So watch that window of late March, early April. If there's not movement by then, we really begin to impact our ability to move through tax reform.
And do you think tax reform takes place for 2017, or is that a 2018 implementation?
It's got to be 2017. You begin to look at the politics of an election year. They become difficult on the heavy lifting that I think would be required with tax reform.
Congressman, we know you have a lot on your plate. We'll be watching. Thanks so much.